At a policy level, education and health are very, very similar in dealing and discussing with local councils, with state government and with federal government. So it was a natural progression for me to work out of Education City and then also focus on Health City.
And the beauty of the Cancer Care Centre is that people want to be treated locally, and I think you and I know that's what makes it so important to this community, is the fact that you live local, you get to have your treatment local. You don't have to drive into South Brisbane, you don't have to drive to Ipswich.
We're starting to talk to scientists around when the temperature increases, whether it's a 0.5 of a degree to 2 degrees, those traditional foods, medicines, plants, wildlife, how are they going to be impacted? Which ones aren't going to be there? So it's sort of sombering now to start having those discussions.
The other thing that I was bullied for was being Aboriginal. I'd hear things from other students after the weekend asking how much petrol I sniffed on the weekend, and it was just a lot of negative stereotypes, which was really hard because that's who I am and that's my culture, and I am proud of that.
I'm going to be blunt too. When you were there with Nick had concerns about you. He was contacting me and says, I'm worried about Naren.
Yep.
He was saying, is it true that you had snacks in your bag?
Yeah.
So that was one of his concerns.
Absolutely, I did. I would hide them. I would have chocolate biscuits. I would have lollies. I would eat them in the toilet.
I remember my first state game. I walked into the South Australian dressing room with a fast food packet, breakfast packet, and the captain, Jamie Siddons, looked at me and just looked at the packet, and he had a few choice words, but they basically said, don't ever bring that stuff into my dressing room again. And I learnt a very quick lesson then.